This conference will now be recorded.
Paul. Okay. Only 8:01. Should we wait a little bit?
Yeah, we usually have a few stragglers. If you want to start taking down notes of who wants to talk first, I guess you could do that.
Yes, I would like to do. And let's start with you, Jake. Why not?
No, I don't have anything to talk about tonight, Len.
Okay.
I'll
Dennis.
throw on my 2 cents, though, as usual.
Okay. Always welcome.
Or penny's worth, whatever it is.
Okay, Dennis, can you hear us?
Yes, I can. Len, how are you?
I'm well. How are you?
Okay, just a quick question for anybody out there. So.
All right. And Jay? Good evening, Jay.
Nothing for me tonight, Len. Thank you.
All righty. Mr. John Appler.
Yeah, hi, Len. I just have one quick question. I have some out-of-range scores. I just wanted to mention to see if anybody else has the same thing, but not a big deal.
Okay. We'll get to that. And I think this is a name I don't remember. Michael? You know who that is, Jake?
Not by the first name. Welcome, Michael.
Michael, can you identify yourself? Okay, we'll get back to Michael. I see Gary. Okay, Gary.
Hey, Gary.
Yep, I'm here. Hi, guys.
Hi, Gary. Interested in speaking tonight?
No, I don't have anything in particular tonight.
Okay. And there's Jake. And Paul Frieda. Hi, Paul.
Hi there. Nothing for me tonight.
Okay, it looks like it's going to be another very quick evening. All right, we'll wait a little bit. If anybody's interested and you get the new prostate cancer info link updates in your email, they had a 12-minute discussion video interview. Charles Ryan interviewing Heather Cheng in Seattle. She's one of the gurus of genetics and prostate cancer. 12-minute interview. If you're interested, check it out.
Yeah, I posted a link to that on the Facebook page. I have not had a chance to review it myself, but Charles Ryan's always good, and I don't know who was the lady he interviewed.
Heather Cheng, C-H-E-N-G, from Seattle.
I'm sure it'll be a good interview.
According to Charles Ryan, she's one of the thought leaders for prostate cancer genetics. It wasn't overly informative, but something of interest there for Peter, who isn't, I think Peter's MSH2 Lynch syndrome. He has that genetic mutation, and
right.
He already knows this, but pembrolizumab is being used to treat prostate cancer patients with that particular mutation. So that's a possible option for Peter down the line, but probably not yet. So far, oh, he may or may not join us this evening. He's in a car driving around with Susan, his girlfriend, somewhere in Minnesota, on their way from point A to point B.
Does everybody know where our Facebook page is, so you can see the link that Len is talking about?
Ancan.org.
Well, yeah, no, we have a Facebook page too. I don't think Rick has posted a link to that yet. He may very well later, but I'll put the Facebook page in the chat box
Okay,
while we're waiting. Hang on, give me a minute here.
Is it Facebook/AnCan or Answer Cancer?
Answer cancer.
Okay. Seen some pretty frightening news stories about the current state of global oceans. All kinds of problems, garbage washing up on shores in Hawaii, Norway, all around the world. Pretty frightening.
Oh yeah. And there's an area in the middle of the Pacific Ocean, I believe it's the Pacific, the size of a state. It's
State
all,
of Texas, pretty big state.
yeah, it's amazing. And now it's washing up on the shores too, huh? That's
And they said it. One day your beach could be beautiful, and the next day it'd be covered in garbage.
wow.
Good evening, Rich Jackson. How are you tonight?
Hey, Rich.
He's muted.
Yeah.
Good evening, gentlemen.
There he is. Hi, Rich.
How you doing tonight?
Right now we don't want to go there, but I'm here.
That bad,
At least
huh?
for a while.
Okay.
Well, you couldn't be in a better place. We also have another caller on the telephone.
This is Sylvester. Hello, everybody.
Sure.
Hello, Sylvester. Welcome. So, Rich, you've seen better days, but is there anything you wanted to talk about tonight that is not related to prostate cancer?
No, right now I'm just going to sit back for a little bit. Try not to go to sleep, but I appreciate it.
Okay. Well, if you do sleep, we'll never know.
Trying to go to sleep. Thanks a lot, Rich.
And we have Larry Fish. Hello, Larry.
Hi, everybody.
Any words of wisdom going to be coming from you tonight?
I think I'm going to be my usual, nothing special.
Okay. You're always special.
I don't know which way to take that, but okay.
Special needs, you know. No, I'm only kidding.
Yeah, I definitely have special needs, no question.
Don't we all? All right, let's see. We've got 809.
Yeah.
I guess you'll keep an eye on the board, Jake, and let us know if anybody new pops in.
I will.
And I guess, meanwhile, we can start with Dennis, who said he had something quick for us.
Yeah, just a quick question for anyone else out there on Zytiga. I've been on it now for, well, in October will be a year. And it's really doing the job for me as far as PSA is concerned and everything, but it does have its side effects. And this past 5 days, I've had loose stools. And I looked up on my sheet here for side effects for Zytiga, and that's one of the side effects that could occur. And I haven't had it before, so I really think it's probably something else. We were away in California for about a week, and I think I may have picked up something. No fever or nothing like that, but just continually every day loose stools. So I really cut back on my diet. Yeah, just about like once, maybe twice a day at max. So it's not an ongoing thing, but I just watching what I'm eating.
Every day?
Okay.
Yeah, every day. I haven't had a solid stool, which is unusual because I've been usually very regular every day, every morning. I go once a day and real solid form stools.
Well, I would think it's unlikely to be the Zytiga since you've been fine for a whole year. I don't imagine why it would suddenly cause that symptom. You're not on any antibiotics?
No.
And other than traveling to California, you got some crumpling paper going on?
Yeah, that's Dennis.
Oh, Dennis?
Dennis, can you mute yourself? We're getting some noise from you.
For me?
Yeah.
I'm not doing anything here.
Oh, maybe Paul Frieda? I just saw his name pop up.
My apologies, Dennis.
Accepted. Prior to this, I was having some bloating, heartburn, and stuff like that. So I really don't know what, other than taking Pepto-Bismol tablets and Gazex and stuff like that to kind of relieve my pressure. But that was over a week ago now. And then subsequent to that was the diarrhea started.
How long has it been
fine
going?
Otherwise.
How long did you say this is going on?
Just about 5 days, 4 or 5 days.
Can you think of any changes in your diet, your eating habits?
Well, we were out in California. There was a lot of Mexican type food, I guess. So could have been there.
That might do it.
Yeah. Did you go to Chipotle?
No, thanks.
Good. Don't go.
Have you tried to change your diet recently, just to try to do a bland diet for a few days to try to
that's
clear
what I'm doing.
Clear up what might have happened in California?
Yeah, I started the first day back from California started, so then we started the almost a clear liquid type diet or so for a day, and then gradually started introducing some bland type foods, oatmeal and stuff like that back into the diet. And but it's just about every morning now. At some point is when it'll start.
You're not doing steel cut. You're doing soft oatmeal, not steel cut. Trying to stay away from fibers, seeds, nuts, roughage. Just for a little while.
Yeah, no, that's what I've been doing. I'm aware of it. We did have some. My wife thought she was doing a good thing. Got me some organic little crackers, but they were all whole grain and stuff. So after that, I said no more of those.
Yeah, it's good to get.
So I even bought myself some white bread, which is something I haven't had in ages. Actually tastes pretty good, toasted, just dry toast. But
dry toast is a very, soft-boiled eggs and dry toast.
Yeah.
Yep, that's the other thing I had, soft-boiled egg too, for breakfast. Yep.
Electrolytes, don't forget about a little bit of salt in your diet.
I do that. I've been drinking Gatorade to get my electrolytes.
Well, maybe it's something. Maybe you need to just give it time or an antibiotic. It could be an infection.
Yeah.
A stomach irritation that needs time.
Yeah. Yeah, no more bloating. I haven't had the bloating in about 4 days, or the gastric distress. So I'm just, like you say, I think I'm willing to give this another couple of days. But
yeah,
when
it can take a while.
comes on, it comes on pretty sudden. So I've taken to wearing the Depends. So just to be safe, because when it saves me once already. Of a disaster before I realize it. There's not even enough time to get to the bathroom. So.
Yeah, it sure sounds like you got some kind of bug out there, California, with something you ate, and it'll probably run its course. But yeah, I think you're doing the right thing.
Right, Glenn?
What's that?
run its course. No pun intended.
Yeah.
I know that was bad. Sorry.
If it continues a few days, maybe make an appointment with your GP.
Yeah, that's exactly what the plan is right now.
Yeah. What about yogurt? Maybe that'll help replace some of the imbalance in your gut bacteria.
Yeah, that's a good question. I was thinking that I do have probiotics, and I was wondering if a probiotic might help too.
Yep, sure. Can't hurt.
Yeah. Okay, I think I'm on the right track. Thanks, guys.
Yeah, unlikely to be the Zytiga, I would think.
Yeah, me too. I thought that probably would have started right away if it was the Zytiga.
Yeah. Okay, so we'll check back with you next week, and hopefully it's all cleared up.
I hope so. Thanks.
I see our buddy Bill Franklin has joined us.
Yeah, I'm here.
Hi, Bill. Welcome.
Thanks. How's everybody doing?
We're doing well. We just pretty much got started. We're wondering who would like to speak, or would you like to talk to us tonight about something?
No, don't really have much. I could make a comment, but other than that.
Okay, yeah, we have very few people who have any need to talk tonight, so certainly you have plenty of time. Jot you in there. Anyone else new, Jake?
No. Somebody was on the phone, but then they left.
Okay, and we still haven't identified Michael.
No.
All right.
You're welcome
So
to
how
listen,
about-
Michael. There's no pressure. You're welcome to just listen and see what's going on. You don't have to talk if you don't want to.
Let's see what John Appler has to talk about. Go ahead, John.
Thanks, Lynn. Yeah, I've had brachytherapy about 9 months ago, and prior to that, I had 25 sessions of IMRT, and my blood score is a little bit out of whack when I had it done, but I'm kind of surprised that this far along, here we are almost a year afterwards, I still have low white blood count, red blood counts, hemoglobin, MCV, and MCH. I was wondering if anybody else has gone through radiotherapy or brachytherapy in particular has had this same kind of prolonged problem with their blood count.
John, how long ago was the radiation?
It was about 10 months ago. It was back in September, 11 months ago, September of 2017, 5 weeks followed by HDR brachytherapy in November of 2017.
And how low are your blood cell counts, your white blood cells, for instance?
The white blood cells, it should be in the range of 3.8 to 11.2. I'm down at 3.1. Red blood cells are also below the range at 3.78. I should be up in 4.4 to 6. Hemoglobin, same way, just about 10% below the range, 13.1. I should be at 13.4 to 17. And also something called SEGs and lymphocytes are low as well.
Okay, and the lymphocytes are how low?
Lymphocytes should be 20 to 45 and they're 13. SEGs, SEGS should be 40 to 70 and they're high at 76.
Yeah, this is kind of a familiar pattern for people who get radiation therapy. I have similar blood counts as you, and I'm 2 years from the completion of my radiation, and my hemoglobin is also around 13. By the way, are you on hormone therapy right now?
Yes, I am.
So that's another factor that's going to suppress your bone marrow, which produces white and red blood cells.
Yeah, good point.
Yeah, but
My blood counts are all over the place. 1 month they're high and 1 month they're low. There's no really rhyme or reason, but the doctor never seems to be concerned with mine. So chances are yours are normal, like Len says too. Not normal, but it's not unusual, as he says.
Yeah, it's good to hear. Really good to hear. Yeah.
Yeah, my lymphocyte count and segs, as you call them, there are several names for those. Those are basically the nucleated white blood cells. 76. That you have almost the same ratio I have.
No kidding. Interesting.
Yeah. It's worries me a little bit. It's it's not a good thing. The lymphocytes should be higher than that, but I don't know how long it takes to recover or if they'll ever recover following the radiation. I had extremely high radiation dose. And like I said, 2 years and mine still haven't come up. And I asked my oncologist, I said, is there anything I can do to raise my lymphocyte count? And he said, no, not really.
Wow. Interesting. Good.
Yeah.
That's great to hear. I have a pretty young doctor, and she had these concerns in her face and was going to refer me out to an oncologist. And I said, well, just let me talk to some people about this first. And I'm really glad I did. That's comforting to hear that it's not uncommon to have these kind of scores.
Yeah, not at all uncommon.
Are you still on ADT as well?
No, I'm not even. I haven't been on ADT for something like about 10 months now, and yet there's been a little bit of improvement in the hemoglobin and in the lymphocytes, but I think they were down in single digits for a while, like 8 or 9, and now they're up around where yours are, 13, 14. So who knows? Maybe it'll continue to rise.
Yeah, interesting. And is that the reason just simply the damage done to the bone marrow by the radiation, or is what the low-level issue is there, Len? I'm just curious.
Yeah, it's the 1-2 punch of the ADT, which suppresses your bone marrow, which produces those red and white blood cells, plus the radiation can and usually does decrease, particularly the number of lymphocytes.
Good. Okay.
Yeah, there are a lot of lymph nodes in the pelvic region there.
Yeah, makes sense. Great. Well, thank you for that. I appreciate it.
Yeah, sure. Anyone else want to comment on this subject? Anyone else have similar repression of blood cell counts following radiation or ADT? Okay. All right, let's see. We can move on to you, Bill Franklin.
Oh, okay. Well, the only thing that happened to me, I did have a few of my blood levels were out, but it was all in relation to cholesterol. After radiation, when I was on ADT, I didn't have the things that you guys were talking about, but my cholesterol was out of whack for a while. And that was a time when I was eating healthier and exercising a lot, and there was just really no explanation for it, But
yeah.
I mean, it's back to normal now. So I got another I'll have another full blood workup. I think at the end of the month. Yeah, August 28th or something like that. So.
Okay.
Right before I go back for my PSA and testosterone and all that good stuff. But yeah, I mean, I don't really have anything to report. I'm doing really good. I had a really great day. I feel good. I was just reminded earlier that I had a good day. I felt good. I had a good day at work, and no pain, and all the other stuff from working out or any of the old stuff that happened during all the treatments. And I was reminded of the old Gordon Lightfoot song, you know. Sometimes it's almost a shame when you get feeling better when you're feeling no pain, right? And I thought, you know, and sometimes we get guys that are on the group and they don't call in for a long time because they feel fine. But I think it's important that, you know, even though I feel fine, it's not just that I feel fine and I don't need to talk to you guys. There might be someone else out there who doesn't feel fine and wants to talk to us, right? So
That's right.
just the point I'm trying to make is, you know, I feel good. Do I need to get on the support calls anymore? Yeah, probably, because I need to give back what I got. You know what I mean? I got a lot of support from you guys, and it was really helpful for me. So even on the days where I'm like, should I call in? I think I should, because I should give back to ANCAN. So that's just my 2 cents today. It's just the way I was feeling.
Well, that's awesome. Thank you. I'm glad you feel that way. And we're, of course, we're always happy to benefit from your experience and your advice. By the way, is anyone going to the PCRI conference in LA in September?
Yeah, I wanted to go. Remember last year I had everything planned, and then Hurricane Irma came through and I canceled. I actually I had to evacuate the house and everything. So, and it was during that weekend. Yeah, this year I was thinking it's right in the middle of hurricane season, but nothing's happening.
Yeah, it's been a quiet summer, knock on my wooden head.
And then with work, I had expected to be in Hawaii during that time frame, but I'm not going. So yeah, I'm gonna miss it, but I could have made it this year.
So you are going to Hawaii for work?
No. I'm gonna send somebody else. I just don't want to make the trip anymore.
That's a long ride from where you are.
Yeah.
Yeah, and some of the other people on the project want to go anyway. They haven't been, so I'll let them go.
Yeah. Which island?
Oahu. It's all in Honolulu, at Pearl Harbor and Hickam Air Force Base.
Oh, right.
You know, I like to make a comment about, you comment on the call, Bill. You know, it's Rick has always said, you know, it's good to hear good news. You know, we try to help people that are having problems, but it's always nice to have people that have good news because it gives other people some hope. Not to mention, as you said, that you can, you know, everybody can benefit from your experiences.
Yeah.
So, as long as you can make it, please do.
I'll definitely be here when I can.
Good.
Now school started, so it's 8:29 here. The kids have to be in bed at 9 o'clock, so I might have to drop off early some nights.
Sure,
well,
no problem. How's the red tide situation up by you?
Up here, it's not so bad. It actually hasn't gone much further north than Sarasota, but Sarasota and further south, it's horrible.
Yeah, I was in Venice last week, and it was pretty bad.
Yeah, I was gonna say down by your place, it was my friend works for Florida Fish and Wildlife, and him and his girlfriend both, and they do all the turtle patrols down there, and they said it's been horrendous. Some days they had to wear a full face mask with breathers just to walk on the beach.
It's a shame. It seems to get worse every year.
Yeah, they've had a lot more dolphins wash up this year. They had a freaking 25-foot whale shark wash up.
Yeah.
This was really rare, he said.
That was on Sanibel, I believe.
Yeah. So we're talking about red tide.
Has it ever gone as far north as Tampa?
Oh yeah, it's been all the way up past Clearwater. It's we've had problems in the bay too. It's terrible when it gets in the bay, because then the whole city stinks.
Oh jeez.
You'll be in downtown Tampa, and it's you can smell it.
You see dead fish floating?
Dead fish, or what? What is it that smells?
It's both it's dead fish as well as the stuff that the algae gives off too. It's like fumes, I guess. That's the only way I can describe it. if you breathe it in while you're walking on the beach and it's bad, it really irritates your throat and your nasal passages, and your eyes get all red and watery and sore. So.
Wow.
Yeah, different people have different sensitivities to it. Like for me, I start coughing. I get like a dry tickle and I start coughing and I can't stop coughing. And at the same time, this is happening to me. My wife is fine. And oddly enough, one day we brought pizza onto this was when on Siesta Key this past winter. We brought pizza out to the beach and it stopped the irritation and the coughing. And I think it's because of the greasy pizza coating the membranes. But it did the trick.
Now you're making me hungry.
Yeah. Suppose I shouldn't be eating pizza anyway, but
yeah.
I'm kind of an Italian, but I did.
What's the sense of living if you can't eat something that you enjoy once in a while?
Did we get a new caller while we were talking? I see someone on there called. I can see caller 5.
Oh, yeah. Thank you, Bill.
They might think this is
on telephone?
How come Bill can see that and I can't?
I don't know.
But he's special, Len. Just leave him alone.
Special.
I'm the IT guy, Lynn.
It's right under his name, actually. It should be.
He hacked in.
Someone just joined us on a telephone. Would you like to identify yourself so we know who we're talking to? It's fine if you stay. You don't have to. It's fine if you just listen. You don't see that, Len?
No.
Huh. You should. I even made you the presenter, so you should see everything.
No, I do not. Oh, you did that. I thought I accidentally clicked on something and I saw something about, you are now the presenter. I thought it was asking me if I wanted to share my screen. So I said no.
Oh. Yeah, I don't know. I just do that. If I'm the first one on, if Rick comes on later, I do him. If it's you, I'll make you the presenter.
Yeah.
I don't think it really matters, but.
So nobody wants to talk about prostate cancer?
Yeah, this is terrible. I'll be going to the PCRI conference, and maybe we'll have more to talk about when I get back. I know I can tell you this. I was chosen to participate in a survey on Friday morning, the first day of the conference. They're looking for guys who were castrate resistant and either non-metastatic or metastatic. So they accepted me. And Alex Schultz, who's Dr. Schultz's daughter-in-law, she told me it was being sponsored by a pharma company that has a new therapy that I think is going to be effective for castrate-resistant, non-metastatic patients, and apparently metastatic as well, because they're taking both types of patients. So that sounds promising. Yeah, maybe I'll have something to talk about when I get back about what that was all about.
Yeah, that's interesting. I think Sylvester, didn't you say you're going to go to PCRI this year?
Oh yes, I'm going this year.
Oh, fantastic! I get to meet Sylvester.
But yes, and I'm looking forward to that. But you know what's interesting to me? I've been to several of these conferences, but I never knew until I think last year there was a Friday morning session. I don't usually get there until Friday afternoon. And I heard you say that you have you're going to join some group Friday as opposed to late Friday afternoon. Because I was under the impression you could, correct me if I'm wrong, I was under the impression that I could not check into the hotel until afternoon on Friday. So I'm still a little confused, and maybe when I get there, I'll find out a little bit more information, because all of these years I've been scheduling myself to be there around 2 or 3 in the afternoon. I had no idea they were having morning sessions, and I think someone may have mentioned it to me last year when I was there. But it's interesting knowing that they have sessions before noon, but I don't know.
Do you know if there's been an agenda published yet, Glenn?
Yeah, there has been.
Can we do this?
It's available from the PCRI website.
Do you know how to get to the PCRI website, Sylvester? You can see the schedule.
Yes, I'll do that probably after this session.
If not, one of us can probably send it to you.
No, I think they did send it to me, because
Okay.
I browsed over it, but not really seeking information. I knew they were going to have a schedule when I get there, so I really didn't look at it that closely. But even in the booklets that I think I've been getting, I don't see any sessions early Friday, but maybe I haven't been looking at those booklets with the schedule in it like I should have. So I stand corrected if I made a mistake.
No, I think it does begin early morning on Friday. Excuse me. But you're right in that, most hotels have a 2 or 3 o'clock check-in. If your reservation is to begin, you have a reservation for Friday night, let's say, the check-in would be 2 or 3 in the afternoon. But what I always do, it's only the second time I'm going to the conference, but in both cases, I booked the hotel for Thursday night. So I fly in on Thursday so that I wake up Friday morning and I'm ready to go.
Right.
Good suggestion, and I'll start doing that in the future.
Yeah.
And did you tell them that you're with ANCAN, so you got the discount?
I did, but I heard on the conference someone spoke and said, if you are a veteran, it was free. And this was the first time I heard that too.
Oh, sweet. I know you're an Air Force veteran, so that's even better.
Yeah, and I think $60, even $120 is more than reasonable for the information that's given.
Yeah, for most of us, I think the conference fee is a pittance compared to the expense of the 3 nights or maybe more in the hotel and the airfare.
Right.
Particularly for us on the East Coast. So I guess just to fill in a little time here, we were talking about sharing news, even if it's good news, it doesn't have to be bad news. So I have what I consider good news, and hopefully it's good news for others as well, because I think it can demonstrate that you never know the course that this disease will take. I was diagnosed 4 years ago as a Gleason 9, and I had lymph node involvement, I had seminal vesicle involvement, perineural invasion, the whole bit, everything but bone mets. And I was on ADT for almost 2 years before I did anything else. Like I had radiation therapy 2 years after I was diagnosed. So it was 2 years ago. And after radiation, my PSA was 0.1, and then it started slowly climbing up to Well, it actually went as high as over a period of about 9 months, went up to 0.5. And it looked like it would just keep going up. And that eventually I was going to either have to go back on ADT or get scanned and see what else we could do. But my oncologist said, you know what? I have sometimes seen that after radiation, the PSA will rise and it'll get to level about 0.4, 0.5, and then it will just plateau out there for a while, could be indefinite. So he said, let's wait. And I was not on any medication at all. And so that was October of 2017. And here we are, August 2018. And sure enough, my PSA has been locked in between 0.4 and 0.5. It hasn't budged.
Great.
Testosterone levels are high. And yet, PSA hasn't budged. And I feel pretty good. So you just don't know what's going to happen. I thought for sure I'd eventually have to just keep rising, and eventually I'd have to go back on some form of therapy. But so far, so good.
You do scans, Lynn?
He didn't want to scan me because he said, while you're stable, the scans may not pick up what's going on. He said, let's hold off the scans until your PSA starts rising again. So,
okay.
So I haven't been scanned. I hadn't been scanned since just before the radiation therapy began.
Mm-hmm.
Len, you mentioned it was an ultra hard radiation, or it was an intense radiation. I mean, is that what you attribute your great things going on?
Is that what I attribute the success
the
to?
good news, yeah, success to maintain the PSA at such a consistent low level.
Yeah, it's possible. Who knows?
Yep.
So you're not taking Lupron anymore?
Nothing. No
Why'd
Lupron.
you go off the Lupron?
Okay, so what happened was, after the radiation, I was kind of looking forward to, I was continuing to take ADT, but I was looking forward to a break because I had been on it for about 15 months straight. And so I had switched oncologists at that point. So this is really bizarre story. So January of 2017, I switched oncologists. And I said, I'd like to go on drug holiday. And he said, well, before we do that, my PSA was 0.1 at the time, 0.11. So before we do that, let's add Zytiga to the Lupron, see if we can knock you down to non-detectable, and then you can go on drug holiday. So he added Zytiga. And so for 3 months, I was on Zytiga plus Lupron. So January, February, and March of 2017. So rather than go down to 0, the PSA flared up a little bit, went to 0.17, 0.23. And then in March, the 3rd month that I was on Zytiga, it went back down to about 0.15. So I said to the oncologist, okay, look, as far as I'm concerned, I see a trend here. Zytiga is working. It's coming back down, but I want a holiday. I want a drug holiday now. So that's what we did. So starting in April of 2017, I stopped all medications. And as I said earlier, that's when the PSA rose from 0.15 to 0.51. But then it stopped, just stopped there. So it's a peculiar progression, a peculiar story.
Well, you still have a prostate though, right, Len?
Well, I don't know if anything's left of it after I had 86 gray of radiation, and the only cancer center that does that is Sloan Kettering. Nobody else gives that high a dose.
Well, it's always been my understanding that if you have a prostate, you're always going to put out some PSA. It's not that it's cancerous, but that your prostate puts out PSA, regardless if you have a prostate. So that may very well be the explanation of what's going on with you.
Well,
I don't
but
know.
you can say the same thing if you have surgery, right? Couldn't they leave behind a few prostate cells even if you had surgery?
Well, yeah. Somebody said that the other day, or last week, I think they said that, or they thought that was what was happening.
Yeah, so when I had my surgery, I had a radical prostatectomy, right? And the surgeon, it was inconclusive, but she didn't see anything that looked like it had spread outside the prostate, right? But shortly after the prostatectomy, my PSA started rising fairly rapidly. According to her, the prostate was gone. She took everything, right, and saw no signs of cancer. And I was not metastatic. I mean, nothing showed up on any scans, but yet my PSA started rising rapidly. So, then that's when I went into radiation. So who knows?
Right.
How much can be left behind and then start that? One cell, or
Yeah, you wonder.
Len, do you worry about with that strong of a cancer, a Gleason 9, and a rich testosterone environment? I mean, are you just kind of deciding to take a risk by getting off ADT totally? I mean, what's that conversation like with you and your doc about that?
Yeah, I think it worries him more than it does me. I guess, however bizarre it may sound to some guys, I'm comfortable with that risk. I know some guys, well, I think we spoke to Gary a week or maybe 2 weeks ago, and he wasn't comfortable with any rise in PSA level. And that's fine. Everyone is different. For me, I just was willing to take the risk and get as much freedom from ADT as I could. Give my blood counts a chance to bounce back a little bit, have more energy to do things that I wanted to do. And so far, it's worked out pretty good for me. Could suddenly turn on me, but it's I won't regret what I did. It was the choice I was comfortable making.
And you're still are hormone sensitive at this point, so you guys go back on Zytiga and Lupron as well. Yeah.
I guess it depends on how you define hormone sensitive. Apparently, I was resistant to Lupron because while I continued on Lupron, the PSA stopped going down. It was only after he added Zytiga, even there is something called Zytiga flare, and I guess it happened to me. And it went from 0.1 up to 0.24 over a period of 2 months before it started to go back down. So yeah, I guess you could say I'm probably sensitive to Zytiga, but not to Lupron.
Yeah. Okay.
But it's definitely not a typical case. Now, one of the risks I took in getting such a high dose of radiation, not that it was my choice, it was Sloan Kettering's choice, is that I did develop the radiation proctitis, even though I had the hydrogel inserted, SpaceOAR. I was good for about a year. I was fine, no problems. And then all of a sudden I started seeing blood in my bowel movements, started like 1 or 2 times a week. And then over a period of a couple of months, it was every day. No pain, but just, a little, the first few times you see it, it's more disturbing. After a while, it's yeah, I got blood again. Okay, fine. So anyway, there aren't a lot of treatment options for radiation proctitis or blood in the stool. You can have argon gas laser ablation of the lining of the colon, or you can have hyperbaric oxygen therapy. And there's mixed results with both of those, and they're somewhat invasive. Particularly the hyperbaric treatment requires, it's almost like going through radiation again. You know, it's painless, but you have to make like 40 trips or something. So, and I remember, I don't know how many of you guys remember Venice Jim Cammon. He had hyperbaric treatments and he developed cataracts after that. And that is a known side effect. So I didn't want to do that. So long story short, I'm in Connecticut. We do have medical marijuana, and not as a treatment for radiation proctitis. I got the license in anticipation of someday being in severe pain, and it's well known that medical marijuana can work with opioids to keep your opioid dose down. So, you know, I just started taking it. And also there's a type of, there's an Indica strain. I don't know how well you guys know medical marijuana, but there's a type called Indica strain that doesn't cause a high, but it helps you to sleep. And I was having some difficulty sleeping. So I started taking that. It's like they call it a slip. It's a very thin, almost looks like a little piece of paper. You put it under your tongue, and you take it about 20 minutes before you want to sleep, and it just dissolves in your mouth. And I noticed that after about a month of taking that the bleeding stopped, the rectal bleeding. And so, you know, now I think I'm pretty sure that I took a break from taking the slips at night, and then the bleeding came back, and then I started it up again, and the bleeding went away. Not 100%, but like 90% improved. So yeah,
strange but interesting.
Yeah, I think I'd like to pass that by Alan Adele. He's like the guru for radiation,
Right.
and see if he's ever heard of that being a successful treatment for radiation proctitis. And again, it could be something that maybe it works for me and not someone else.
And it wasn't the CBD, the CBD oil. It was actually the Indica version of normal marijuana with THC in it. It's just the high CBD version of medical marijuana, it sounds like.
Could be. On the label, the way they wrap the label on the Indica slips at the clinic where I go, it's a strong glue, and they cover up some of the ingredients, and you try and tear it off, and it rips it off. But I did see that it says 23%, oddly, 23% THC, which sounds high to me, and yet I don't get any marijuana high from it.
Interesting.
So yeah, it's probably high in CBD content.
Yeah, they haven't studied CBD that well because, you know, in the past it was always illegal, so no big studies were able to be done. But there seems to be a lot of therapeutic from animal studies. I mean, things like it'll actually reverse, you know, liver damage, you know, damage that alcohol would cause to your liver. So it's got a lot of kind of interesting side effects that they're learning through animal studies in anticipation of human studies.
Yeah. But I think they're about to start allowing clinical trials with marijuana.
Good.
But you're right, CBD is a known anti-inflammatory.
Yes. Yeah.
and that's what's going on in the rectum.
Yeah, I use that myself also. Just started it, and it seems to do well. It also has the benefit of lowers your blood pressure a little bit, kind of calms you down. Has anybody else tried CBD oil as a kind of a medication for inflammation and anxiety reduction?
I haven't.
It seems to work for me.
And is that John that's speaking?
Yes, I'm sorry.
Yeah, okay. Can't always tell.
No, I think I might have misnamed somebody, Len, because Dennis Correa keeps showing up, and I don't think it's Dennis talking.
It's not me. I saw that. I was going to let you know about it and see if nobody seemed to notice it.
Yeah, I got him.
My name shows up when anybody's talking.
You're showing up now that you're talking. You're showing up as John Appler.
I saw that too.
Oh, so I was the one causing the noise before then.
It might be that. I'm sorry.
That's okay. Probably was.
Okay, John, if you speak up one more time. Well, now we have 3 Dennis Correa, so I may never get it right.
Okay, this is John Appler from Hawaii speaking right now. So, can you see me light up there?
Yeah, I see your name at the top, but it doesn't really say again.
John Appler, Maui, Hawaii.
Gotcha.
I was rustling a bag earlier, so that was, you probably blamed Dennis for my screw up.
I did.
Oh yeah, but it did sound like paper crumpling.
Cut that out, John.
Yeah, that was my wine bag being crumpled.
You don't have to cover it up in your own home, John.
Yeah, that's right. It is a brown bag, actually.
Gary or Sylvester, if they wanted to talk about anything.
What was that?
Did you ask Sylvester or Gary if they wanted to talk about anything?
No, I don't have anything tonight.
Yeah, and I did ask Gary. He said no.
Okay.
Yeah, nothing for me tonight.
Okay.
Yeah.
Hi, Len. It's Rich.
Hey, Rich.
I'm probably a few months or a few years behind you, because I'm Gleason 9, did
Right.
high dose brachytherapy and 25 IMRT I'm going to do 12 months ADT. So I've got one more shot due the 29th. Currently,
Okay.
I'm running point 1 and PSA 0.1 and point 0.01 for the other PSA, free PSA.
Oh, okay. Oh, I didn't even know they still do free PSA once you're already diagnosed. I thought that was strictly a criteria they used to see if you had.
He may have been bored.
See, it's for the high risk of having cancer in the first place. Yeah. That's what I
got to pay the bill somehow, so that's okay. But I'm pretty much looking at about the same thing that you did.
Yeah.
12 months instead of longer. But right now, nobody's mentioned Zytiga. But all my Gleasons, 5 of my Gleasons were 9s. I don't think I had quite. I may have had the same biological radiation dose, but because it was high dose brachytherapy, the numbers work out a little bit differently.
Yeah, they do. I don't understand it.
Yeah, because it was 15 high dose, 45 IMRT, but the total biological from the 15 high dose brachytherapy was 25 or 28. It was noticeably higher because I guess the contact time and the proximity.
Right. Where did you get your radiation therapy?
DePaul Medical Center Dr. Bradley Prestige, Norfolk, Virginia.
Okay. And so how long have you been at 0.1?
The high dose was January of this year, and end of July we did the 6-month follow-up, and that was the first PSA, first testosterone following the high dose, and I completed external IMRT the 2nd of March this year.
Okay.
So
yeah, you're a couple of
right
years behind me.
Yep.
Yeah, I also had very, I think they call it high volume prostate cancer. They did the MP-MRI first because I had a PSA of 48, and so they did the MP-MRI first to see where the cancer was, and they wanted to do 12 cores. And at that time, I was reading about problems that could happen from biopsy. So I said, look, you know I have prostate cancer. You see it in the scan. My PSA is 48. Why don't you just target about 6 of these lesions and, do your pathology studies on that? So they said, yeah, okay, we'll take 3 from one lobe, 3 from another. And everything was Gleason 9, and the percent of cancer tissue from my pathology report ranged anywhere from 50 to 95%. It was like this one huge cancer blob in place of my prostate.
Wow.
And as a matter of fact, the reason why I didn't have radiation therapy until 2 years after I was diagnosed is because my oncologist at Sloan Kettering said, now it's too late for you for surgery or radiation, we'll just put you on ADT. But Rick said, Len, you should get some kind of primary therapy. So then I started talking to radiation oncologists, a couple of them, and they all said, oh yeah, definitely, you could be helped with radiation. And so that's why I had it 2 years late. So that's another unusual sequence in my illness. But yeah, it's kind of strange, here you have an oncologist at Sloan Kettering, and he's telling me to do something that just about nobody else agreed with, which is why I switched oncologists.
Yep. My DT started December of last year. So I had a month and a half, a little over, before they did the high dose. And then I'll be finishing up the year. The last shot's the 29th of this month for last 3-month shot. And hopefully I'll start feeling like a human being again.
Yeah, it's a good feeling when you go on drug holiday.
Been a long time since I felt like that.
Yeah.
Good luck to you, Rich.
Thank you.
While Rich was talking, Peter showed up. He left us, then he came back, and also Eric Bookbinder is here.
Oh, well, how about that? We haven't seen Eric in a while.
Yeah. Welcome, Eric.
Peter,
Welcome.
we see you all the time, but of course, so he's happy to have you on board. So let's start with Eric. You want to talk to us tonight, Eric? How are you? You look good. Hair's growing back.
Can you hear me now?
Yes.
Yep.
I just had to unmute myself. Yeah, so I started Keytruda 2 weeks ago. Haven't had much side effects except fatigue. I seem to be able to fall asleep anywhere, anytime. You can see my hair is doing something weird, but it is coming back.
Yeah.
I don't know if the Keytruda will do anything to that. We'll have to see.
When did you start?
2 weeks ago. I'm getting infusion every 3 weeks.
Okay. How long is the infusion?
Oh, it just takes half an hour. It takes longer to prep everything than it does to actually do the infusion.
And the only side effect so far is the fatigue and the Cupid look.
Yeah. Well, I'm also I'm losing weight at a rapid rate. I keep trying to do things about it, but I've lost 30 pounds.
But not just since the Keytruda.
No. Over the past 4 months.
Do you take metformin, Eric?
No.
You do not? Okay.
No, I don't.
Because that'll make you lose weight for sure.
Yeah, I know that. It's been mentioned, but none of my doctors have mentioned it in any way. So things are. Oh, I had a bone scan. It was pretty awful. Spread to my ribs, to my pelvis, to more vertebrae in the neck. Maybe some lymph nodes, they're not sure, but because it was a bone scan. But at any rate, I'm hoping that this Keytruda does something because the cancer is definitely winning at this point.
What was the rationale for them giving you Keytruda? Was it, do you have a mutation that they know it's effective against?
Yes.
Which one did you have? Was it ATM?
God, I don't remember. I think I have HER2.
ATR, right.
But I was supposed to go on a trial, and the trial bombed out before I got on it. So they said that they had to stop it because the side effects were so bad. That was the one that's the middleman drug where it searches for PSMA and attaches itself via PSMA, and then the T cells attack it, but it's at that point part of the cancer cells, so it tricks the T cells into attacking the cancer cells by being in the middle. So,
right. Was that something like EF14 or 414?
Again, yeah, I have the paperwork. I don't have it in front of me.
I think it was ES414, if I remember correctly. Does that sound right?
Yeah, I think so. Yeah, that sounds right.
Yeah. So now you're just getting the Keytruda.
Yeah, and I'm going to get 3 sessions of the Keytruda, and then they're going to do another bone scan. And if it's not doing anything, we'll look for something else. So.
Has it had any effect on your PSA? Have you had a PSA since you started the Keytruda?
Well, it's only been 3 weeks. So I had a PSA 10 days ago, and it was 120 or something like that, but which is about where it was before. It's actually gone up a little. So.
How's your back and your movement since your surgery?
Well, I go through periods of intense pain, and like right now, I don't feel it at all. I have no pain at all. I can't even feel it. But in the middle of the night, I had to help my wife out, and I had to lift her, and I hurt my back, and it was again like knives in the back. And I did take some Oxy. So I take Oxy about 1 or 2 every other day, and that's it. So I'm not worried about taking too much of it at this point.
And you have no other pain meds?
Oh yeah, no, I take MS Contin 60 mils in the morning and 30 mils at night, extended release. So that's just my standard round of 30 different pills that I take, because they have me on three different drugs for my low blood pressure, and calcium, potassium, magnesium. What else? So I'm doing Lovenox. So I get to stab myself. It was twice a day. Now I only have to stab myself once a day.
What is that for?
Well, when they were setting up to do the surgery on my back, they said they found 2 PEs in my lung. And so they put in a filter before the surgery. And then a couple of weeks after the surgery, they took the filter out. And I had to start on the Lovenox 2 weeks before they took the filter out. And so when I've asked them about how long I'm going to need the Lovenox, they say somewhere between a long time and the rest of your life.
So that's an injection. That's a theory. I guess it's a blood thinner.
Yes, it's actually an anticoagulant.
Anticoagulant.
Yeah. So yeah, and I asked about taking it orally, and they said, well, it's not as effective, and blah blah blah. So for now, we're going to go 3 months of injections, and then they'll look at whether they can convert me to something oral.
Right.
Eric, do you take yourself back and forth for treatment, or you get a ride, or?
I get a ride. Yeah, no, I can't drive anymore. I have this condition where my muscles will just let go. So if I'm holding something, it just drops out of my hands. And it happens with my arm muscles and my leg muscles. So it'll also knock me down if I'm standing up. So as soon as I feel it coming on, I find a chair or I sit down on the ground. And it can last anywhere from a minute to 10 minutes. And so it's just not safe to drive with that condition. And none of the doctors have been able to have even the remotest clue about what's causing it. It's part of the orthostatic hypotension. So we know that's part of the deal, but they've just had no way of treating it.
Do you lose consciousness when that happens?
I do not, except maybe for a millisecond. I feel like I'm losing it and then coming back. I'm losing it and coming back. I'm losing it and coming back. That's what it feels like. Huh. But it's just an instant that it loses it. And that's when my muscles all just relax.
Right.
So.
And the weight loss, Eric, is that because your appetite is suppressed, or?
Yeah, I think so.
Okay.
Yeah, a lot of food. It's the first time I was on chemo, it was extreme, but it's similar to that. A lot of food just tastes like, most starches just taste like cardboard to me, and meat. Meat has to be a certain. I don't know. It has to be cooked a certain way for me to eat it. If it's cooked any other way, I can't eat it. And I'm not even sure I can tell you what that way is. I don't know until I put it in my mouth, and then if it feels like I'm going to throw it back up, then I don't eat it.
What about high calorie supplements like Ensure?
Boost?
Yeah, I have some around.
Boost.
I haven't gone over to taking those. It's probably a good idea, especially since they came out with the one that has a lot less sugar and a lot more protein in it. The one had it had like 10 grams of sugar in one little bottle. So now it only has one. Yeah, that is a good idea, and I'm probably going to have to do that. I can't really take losing much more weight.
I think Len's right. I think the one to take is Ensure. I take Boost because my wife buys it for me, but it does kind of boost your blood sugar.
Right.
And I think the Ensure, I know there's a high protein version. I didn't realize there was a low sugar version. And it's not bad. They taste like milkshakes. They're really not bad at all.
I like them.
Yeah, I do too. They weren't so damn expensive. I could, drink them like water.
Right.
They are very
right. Yeah, they are. Yeah, I have a constant battle with just maintaining weight, but I've been that way almost most of my life.
No.
Look good, Eric.
I'm 6 foot. I've never been more than 170.
How much?
Right now, I'm about, what's that?
You never been how much? More than how
I've
much?
never been more than 175. But since I was diagnosed, I've never been more than 100, about 160, which is about where I am now.
Yeah, when I was on the steroids, I got all the way up to 185. And I'm 6 foot too, also 6 foot also.
Yeah.
And yeah, in general, my weight was in the 165, 175 range. And I'm down to 155 now. So.
It's Larry Fish. You know, sometimes it's possible to create your own formula. If you look into the ingredients and Ensure and some of the others, and try to mimic that, or just to blend things together. I remember back when I was doing a clinical dietetic internship, we used to at was it Lutheran General in Chicago, outside of Chicago, and they were making their own formulas, especially for the oncology unit. And it seemed that sometimes it was better tolerated because they could get depending on the electrolytes, on your electrolyte balance, on how much water you want to put in it, how you tolerate it. So if Ensure works fine, I guess there's no reason to go into the complexity of creating your own formulas. But if someone wants to put effort in, you can find drinks that serve the same purpose, and you can control all the different factors, like the sugar, like the protein, like geez, my mind is blank right now. But anyway, it doesn't take that much research, that much time to look into it. If you have effort, if Ensure or one of the other standard products annoy you when you read all those ingredients. Just wanted to mention, I don't know if anybody, I'm not at that point where I'm thinking about anything like that. So I do remember we used to spend a lot of time doing that at Lutheran General in Park Ridge or in Chicago, near Chicago. I can't remember exactly where. It was 40 years ago. Anyway, just wanted to mention that idea.
Not a
I
bad
do
idea.
have. Oh,
I
yeah.
also think though that some of these drinks, I think they add vitamins, which probably are not readily available. I'm not sure about that. They add sugar to make them taste good, but I think they add vitamins too, and that might be difficult. And if you make your own, I don't know. It's worth looking into. Good thought.
Yeah, they do. They do add vitamins.
Right.
I don't know how necessary they are, but I guess if you have a poor diet or you're not eating well,
right,
then yeah, they're essential.
If you don't have an appetite, yeah. So
Yeah.
for somebody like Eric, they might be. Well, anyway, Ensure Boost would be very good for you.
I mean, those things. They also at that time they did a lot of more with TPR than they do now. A lot of people had ports in, and they got this total parenteral nutrition. So they were people who weren't swallowing, and you could just take a multivitamin or work with the vitamin part. It's not that complex. I don't remember. It's been so many years exactly how we went about creating formulas, sort of personalized. But it was a very nice concept.
What'd you say? TPR? What is that?
Well, sometimes total parenteral nutrition.
TPN, yeah.
TPN, I mean, yeah. TPR, total physical response. That's ESL teaching. Sorry.
Parenteral is by mouth. Is that correct?
It can be. Usually, it's like either for a tube feeding or it's for they put a port in. if you can't, if your system's not working.
Yeah, parenteral is usually non-oral.
Non-oral.
Okay. IV would be considered parenteral. So Peter, I know you came late. We just about ran through everybody on the list, and we should ask you, would you like to say anything this evening?
Well, I don't think I have a great deal to say right now. I'm still doing fine. Looking forward to talking to my oncologist in 3 weeks or so, right after the PCRI conference. I mean, I'm always impressed every day how well I'm handling the Zytiga and the Lupron. It's nothing like the last time I went through it. I mean, I feel energetic. I start lagging, but it's usually, after 14, 16 hours into the day or something, I start getting a little tired. But I can handle going to the gym. I can handle whatever projects I have. Yesterday and today was moving boxes and stuff out of my girlfriend's cabin in the woods. Loading the truck, and I just seem to be doing fine with it. Makes me scratch my head a little bit because it hurts.
That's great.
Fatigue and stuff. This is 5 months in now, so I don't know.
Fantastic. We had someone mention earlier, I think it was Dennis, that been on Zytiga for a year, and all of a sudden he had like a week of loose stools. And he was wondering if it was the Zytiga, but there were other factors that were more likely causing it. You haven't had any bowel issues with Zytiga, right?
I don't think it's, no, I wouldn't put them on Zytiga, no. No, I think I have pretty good digestion, pretty good appetite. I think the metformin I'm using has kept my weight down. And I've been able to actually lose maybe about 8 pounds in the last 3 months or so, which has felt great. It's given me more. Yeah.
I know you travel a lot. I was wondering, how do you manage to continue your exercise routines when you're on the road, when you presumably don't have a gym membership away from home?
Well, I do actually. My home gym membership is Anytime Fitness, and they have branches all over the place. There's a branch a couple miles down the road here in Minneapolis. But the apartment where Susan took has a gym downstairs, and I'm going to go work out after the phone call tonight. So I have access to that. And, usually I can find a place. Anytime Fitness gives me an electronic key. I can go to any gym in their network, and I'll go any time of the day, just buzz myself in and use it. So it's a pretty good deal.
It's a 24/7 facility?
24/7, whether I'm at home or any place else where they have a branch.
That's amazing. That's great.
Yeah. Yeah, that's kind of why I did it. That's, I just managed to keep it up. And I find that, I could do exercise at home, but if I actually go to the gym, it's a commitment. Once I'm there, I make myself work for an hour and 15 minutes or so. It's different when you're home. You can kind of goof off when you're home.
Yeah, I'm the same way. I can't exercise at home. There's no way.
Yeah. So anyway, that's been working for me.
Cool. That's great. Well, I have a feeling we'll be hearing good news from you after the PCRI conference when you see, who is that you see? Turner?
Turner, Dr. Turner, Jeffrey Turner.
Yeah.
I know Rick doesn't have a lot of faith in him. He thinks he's a little too aggressive. But I I think he's had my back for 4 years, and I have pretty good faith in him. I think he's a good guy. I think he really cares and listens. And I don't do everything he says. We can talk it through. He doesn't. He's a very responsive guy. So anyway, that's
yeah.
Good. I've recommended him to a number of men in Maui that I've run into that chose to get treatment on the mainland. 3 or 4 guys particularly, and they seem very happy with him too. So.
Did you manage to get a hold of the man junk contraption?
I haven't hooked up with John Teisberg yet. He was out of town until I think he was out till yesterday.
Oh.
I just got back this evening, so I'll check with him tomorrow morning. See if we can connect up. I want to do it this week. I don't want to wait till the last minute. That's for sure. Yeah. So other than that, it's going well.
Good. Okay. That's good. Mostly good news tonight.
Yeah, a lot of good news stories tonight.
By the way, Jake, I meant to tell you, your image was frozen for about 10 minutes earlier, just a little while ago.
Huh.
For whatever that's worth.
Okay, I'm sorry about that. I didn't notice it on my end.
Yeah. And there's Gary.
There he is.
You guys are talking about exercise and not exercising at home. And I'm finding, so I had a problem with my incontinence. So right after I would empty my bladder, I would have incontinence. So I started to do my Kegels. So I would lay down and do my Kegels. And then I started to do all these exercises. And I think Peter was a big help for me with that. He's, when I'd say, well, I'd do the Kegels, and he'd say, well, do you do this and that and that and that and that? And I'd say, well, so now after I empty my bladder, then I do about 10 minutes of exercises. And it's amazing how much just a short set of exercises is how easy it is to do. And I'm just shocked at how much stronger everything is for me. Like my lower back is way stronger than it's been in years. My abs are, I'm almost at a 6-pack anymore because they're just so strong anymore. And I exercise all the muscles that come into my the middle area, but then I just decided, why not exercise everything? And so then I do arms, I do legs, I do all of these things, but I don't do them every time. So I just maybe do 8 to 10 minutes each time after I go to the bathroom. And wow, I'm just shocked at how it's really working for me. So it doesn't take a lot to go out and exercise. I also then I do a lot of walking because I can't run anymore. There's issues for me with running, but I do walking when every day whenever I can. So but the weightlifting exercises, weight bearing exercises are something that I do every day, probably 4 to 5 times every day. So it ends up being about 40 minutes every day. And it's real easy at home. And I just thought I'd throw that out there.
So you just do everything in short bursts? Not.
Yeah.
Huh, okay, that's interesting.
And the walking you do in your house on a treadmill as opposed to going outside?
No. As soon as I know that my incontinence is not. No, actually, in the morning, once I've had my bowel movement then I say, okay, it's time to go. So, you know, then I'll get outside and I'll walk for an hour and a half or so. And I have different routes that I take so that it doesn't get boring. But yeah, so, and then I was reading something, I don't know where it was, but it was that short bursts of exercise are every bit as good as the long thing. So I thought, wow, and I can tell you that it's really working for me. The muscles are way stronger than they used to be. And I know that my doctor's really happy because I have that osteopenia. So she's like, yeah, I really want you to be weightlifting and all that sort of stuff. So it's not as hard to do as you really think. As long as you just do it each time after you go to the bathroom, you just come back and you just do it every time. It's become like part of going to the bathroom for me. So
How's the when you're out walking? How's the air pollution? Are you still getting affected by the fires?
I'm going to tell you right now, we cannot leave the house right now. It's off the charts.
That's what I was afraid of. Yeah.
Yeah, no, there are days when the wind blows it all away. But for the last 2 days and for the next 3 days, we are in the hazardous condition. So you basically can't leave the house unless you wear a mask. I'm in Spokane. Anywhere in the Pacific Northwest. It's blowing down out of Canada. It's off the charts. It's so awful.
You're getting it from both sides. You're getting it from California and Canada.
Yeah.
Wow.
Yeah, my sister was just at Glacier National Park, and they had to leave because of the smoke.
Yeah, that is, but that's a really small one compared to all the rest of them. So yeah, no, this is I'm looking out the window right now, and it's, you know, sometimes I can only see just maybe a tenth of a mile, and that's it. It's just the smoke is so bad.
It's got to be a
Peter,
little.
you're in Minnesota, but it's not too bad there, right?
You can't smell it, but it's definitely in the air. You can't see the sun very clearly. It's hazy. It's all, you know, it's here, but it's not any place near as terrible as Gary's. But they warn you here if you've got respiratory issues or something else. My girlfriend feels it because she does have respiratory issues. So it's an issue even as far east as Minnesota.
Hello. Oh, hi, Maintenance. How are you?
Well, if it's not smoke, it's red tide irritating your lungs. We're going to hell. Well, guys, I don't know. I think we can cut it short tonight. I don't know if we have anything else to talk about. What's that?
Unless Michael wants to speak up. Would you, Michael, like to say anything before we go? It's not.
Phantom Michael.
All right.
Okay. I'm ready to call it a night, guys. Thank you for participating.
Thank you.
Rick will be back next week. Tales of Israel and England. And let's see, next week. Yeah, and then the week after that, PCRI. I think we'll probably skip whatever meetings may fall. Oh, there aren't any meetings. PCRI is
the weekend.
Yeah, it's the weekend, right?
And the next meeting is next Tuesday at 6 o'clock Eastern time.
Right.
You got that, Sylvester?
Thanks a lot. I need all the help I can get. Thank you so much.
Hey, don't feel bad. I get confused with these times too.
So do I.
Jake has to remind me.
All right. Well, thank
Have
you.
a good
man.
night, gentlemen.
Good night,
Thank you,
everybody.
Jake.
Good night, everybody.
Take care, everybody. Yep.
Yeah,
Good night.
thanks, Len, for taking the controls, and thanks to all you guys.
Yeah.
And
Thank you, Larry.
stay healthy,
And
everybody, and see you guys in a week or two.
Yeah, thanks, Len. You do a great job. So really
does.
appreciate you.
well, thank you for those kind words, Gary. Are you going to PCRI?
I wasn't planning on it. No, I don't have money right now, but maybe next year.
Okay. All right, gentlemen. Have a good night.
Good night, everybody.
Thanks, guys.
Thanks, Len. Take care.
Good night.